dehiscences. The place where I've been using it most frequently is in degloving injuries.
Okay.
I've had a couple of those that have worked out really well with the MicroLyte stuff. But yeah, some dehiscences that are not, fixable, and we're going to have to let them heal by second intention. A lot of that stuff. I think especially in, today's age of antibiotic resistance and everything like that, we're definitely a little bit more cautious about preemptively putting something on antibiotics. So this not working on, the same mechanisms that we're worried about with antibiotics is super interesting to me. And especially, with animals that come in because sometimes you can just say, hey, we'll wait for the skin to clear up and then we'll do surgery next week. That's not always an option. So sometimes when you're cutting into a surgical site that's got like a skin infection in an allergy dog or something like that, that's just unavoidable.
Yeah.
I think definitely in cases like that, you can have a, serious utilization for this product. The fastest, one of the first cases I had with the MicroLyte product it's the fastest I've ever seen a degloving injury. It was a roughly 35 pound dog. So the surface area of this wound, it was basically the whole top of one of its digits, was probably about an inch and a half by an inch.
Okay.
So generally, especially on a foot, I'm super worried about these getting infected. I'm super worried about these, healing appropriately. It had already been, some skin missing. It had been open for a while, so I didn't feel comfortable closing it in the first place, and kind of informed the owner, hey, we're going to have to let this heal by second intention. When I have talks with people about wounds that size or larger, I'm usually telling them, hey, we're looking at 3 to 6 weeks, depending on how your dog does, if it gets infected. She's young, she's old, multitude of factors. After the first application of a MicroLyte, because of how nasty the wound was, I had them come back just a day later. My assessment of it just a day later was that there was already a granulation bed starting to form. The edges of the wound had been completely separated from the underlying tissues. They had all at least formed an edge. Now, whether that was the MicroLyte that had just kind of covered everything, but it was opposing the edges of free tissues down to the underlying tissue. So in just an overnight time frame, we weren't even at a full 24 hours. We were probably about 18 hours. It looked like what I would expect some of my 3 or 4 day wounds to look like, which was super impressive right off the bat. And that whole wound required, I think, 3 total applications, and was completely healed and starting to restructure collagen at like 12 days, which is crazy fast. So
cool.
That was the most impressive one that I've had, was that degloving injury. But we've also had a carpal arthrodesis that dehisced, that had also pretty rapid healing times as well.